Deuk Spine Institute, streaming live spine surgery. Tuesday, July 7, 2026. Our patient comes from Ohio. He's had 20 years of back and neck pain. Right now, we're going to be working on the back pain. His back pain is primarily coming from, I believe, some disc injuries. However, he also had facet pain. He had basically medial branch blocks diagnostics and RFAs, which gave him temporary relief in Ohio. That has convinced him that his pain is coming from the facet joints, and he wants to treat the facet joints first. So we're going to be doing facet joint treatment today on him. We're going to do L3-4, L4-5, L5-S1 facet treatment with our Deuk plasma rhizotomy. We're going to keep his blood pressure nice and controlled so that he doesn't bleed during the procedure. And we're going to go in and destroy the pain nerves that are responsible for his pain. If you have questions, feel free to ask. In the meantime, we're going to get started in just a moment after we put our patient deeper asleep. You're doing great. Just relax. Now, people talk a lot about Bertolotti syndrome, which is where there's a transverse process of L5 that connects with the sacrum. You can see that on the patient's right side, right there. We're showing it to you with the arrow. Do you see that, Anthony? Bertolotti syndrome. It's basically a transverse process of L5 that articulates with the top of the sacrum. Let me know when we can proceed. If you have questions, feel free to ask. In the meantime, why don't you show the audience how facet joints get damaged through trauma, through injury, and they end up causing back pain through inflammation.
Your facet joints keep your spine moving. When they're injured, the capsule tears, inflammation sets in, and chronic pain follows. Deuk Spine Institute can help. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 34969.
Welcome back. All right, our patient is snoozing, and we are now getting over to the transverse process at left shot, L3. You guys see that? Jordan, you want to show them shot? Transverse process of L3. Shot. I've got to make my way over to the spot. It takes a minute to get there. There it is. All right. So that's one medial branch of the dorsal ramus down and on to the next one. That was L3. Let's go to L4. Shot. L4, on the other hand, has a huge transverse process. Shot. You can see it. Jordan is outlining it for you. I'm touching, I think, the facet. Shot. And now I got to get down to the transverse process right there. Shot. All right. Just keep an eye on my hand there, Jordan. So we're going to destroy the pain nerve here at L4 as well. We just did the L3. Have we shown the audience the 30 causes of back pain, Shot?
No, we have not.
I'm Dr. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining. Welcome back. We are just putting our final touches shot on the Deuk plasma rhizotomy, L3-4, L4-5, L5-S1, bilateral shot. Our probe is right at the base of the facet, superior facet at L5 on the right. And I'm going to just get one more x-ray picture. Any questions?
No questions.
He's got a Bertolotti syndrome. If you look at my probe, I'll point right to it. Shot, see this? Yeah, black line right below my probe. That's
yes.
where the transverse process attaches to the sacrum. So I'm going to treat it with a little rhizotomy action. Hold on. All right, we've got one more medial branch to treat. That's the bottom one, shot. Right near the tip there. Shot. It's a little too far south. I'm going to come up. Shot. A little south. Shot. All right. Just about done, shot. That's pretty much perfect. All right, we're finished. We've done his Deuk plasma rhizotomy. Take a look. Let me have a Raytech with some saline or something. Take a look at the incision, folks. I'm going to clean it up a little bit. You can see the left side, 2 staples, and the right side, tiny little cut. I think he's going to do very well. Just putting in a little bit of numbing medicine to make him feel better while we close up his incision. This is outpatient. This treats facet joint pain, the second most common primary cause of back pain is the facets. He has facet pain, but he also has disc pain. He's going to come back in the future to treat his disc problems. All right, thanks for joining us. Any questions?
No questions.
Thanks, we're done.
Good morning, I'm Dr. Deukmedjian. I'm here with a patient who just underwent the cervical spine Deuk plasma rhizotomy. This was done yesterday late morning, and you're here less than 24 hours later. How are you feeling?
I feel great. I feel awesome.
It's good to hear. Now, you traveled from Texas to come to Deuk Spine Institute because you had symptoms related to your facet joints. We confirmed the diagnosis with a block, and then you decided to move forward with the Deuk plasma rhizotomy, where we go in using a wand called the Deuk plasma wand, and we destroy the pain nerves that are innervating the facet joints. How do you feel that your symptoms, have they improved?
They improved a lot. I can feel that my posture is a lot better than before. I can stay straight without any effort. My symptoms, I still have some residual symptoms, but most of them are gone. And, the doctor explained that they're gonna go away in time. I haven't felt like this in a long time, in years.
Now, are you taking pain medicine since your surgery?
I haven't taken any pain medicine, although I got some just in case, but it was not needed.
Yeah, the procedure is so mild that you don't need pain medicine afterwards, correct?
Correct.
Had you looked at other options for your spine besides Deuk Spine Institute?
Yes, before I found Dr. Deuk, we investigated for years. So we've been to 9 surgeons, neurosurgeons, and orthopedic surgeons. Everyone was telling me that I need to pull out the discs and put artificial ones. I and my husband did our research and realized those have come with a lot of problems. We refused to do that, although I was still in pain for a long time. Slowly, at some point, we found a YouTube video with Dr. Deuk where he explained the problems with the artificial discs, because we are looking for the artificial discs information. And then we found out that he has different other methods, including the disc repair surgery, which I also did. I felt awesome after it. We felt like, we found God, really, after all these doctors, and nobody could help me. No pain medicine would help me. Easily, I can't express my appreciation for Dr. Deuk, and I hope he's gonna take good care of himself and that he can teach other doctors his techniques.
Well, thank you. I appreciate that. Yes, my son Arias is going to become a neurosurgeon. He'll carry on what I'm doing.
Oh, I'm so happy to hear that.
So I feel God has worked in my life and his life to help people. So we're really very happy about it. Anything else you want to tell your fans out there?
I know it's very hard, but if you see this video, give Dr. Deuk and his clinic a call, or he's offering a free MRI review to let you know what would be the best procedure. So just try it. It's really worth it.
You did it, and you were brave, and you came back, and you got it done, and I'm so happy that you're doing well.
Oh, I love you, Dr. Deuk.
You're welcome.
Thank you
My
so
pleasure.
much.
Safe travels.
Thank you.
All right.